Section 13. 1. Blank is a term used to describe practices to keep our bodies clean and healthy. A. Hygiene. B. Grooming. C. ADL. D. None of the above. The answer is A. 2. What is referred to as practices like caring for fingernails and hair? A. Hygiene. B. Grooming. C. ADL. D. None of the above. The answer is B. 3. Which of the following is not included in AM care? A. Offering a bedpan. B. Giving a back rub. C. Helping the resident to wash face and hands. D. Assisting with mouth care before breakfast. The answer is B. 4. Blank are areas of the body that bear much of its weight. A. Pressure sores. B. Bony prominences. C. Pressure points. D. None of the above. The answer is C. 5. The areas of the body where the bone lies close to the skin is A. Pressure sore. B. Pressure points. C. Hygiene. D. Bony prominences. The answer is D. 6. A pressure sore is also called A. Decubitus ulcer. B. Pressure points. C. Broken skin. D. None of the above. The answer is A. 7. How many stages of pressure sores exist? A. 2. B. 4. C. 3. D. 5. The answer is B. 8. In what stage is a full skin loss with major destruction? A. Stage 1. B. Stage 2. C. Stage 4. D. Stage 3. The answer is C. 9. In what stage is the skin intact but there is redness that is not relieved within 15 to 30 minutes? A. Stage 4. B. Stage 2. C. Stage 3. D. Stage 1. The answer is D. 10. A blank skin or blank skin may be placed under the resident to absorb moisture. A. Goat, pig. B. Cow, dog. C. Sheep, chamois. D. None of the above. The answer is C. 11. Blank heel protectors help keep feet properly aligned and prevent pressure sores. A. Stuffed. B. Padded. C. Packed. D. Shield. The answer is B. 12. There are many types of ointments, creams, and lotions that are used to treat, soften, and protect the skin. A. True. B. False. C. Maybe. D. None of the above. The answer is true. 13. Blank is a weakness of muscles in the feet and ankles that causes difficulty with the ability to flex the ankles and walk normally. A. Foot pop. B. Foot roll. C. Foot curl. D. Foot drop. The answer is D. 14. What helps prevent foot drop? A. Footboards. B. Footstools. C. Foot roll. D. Foot curls. The answer is A. 15. Hand rolls does not keep fingers from curling too tightly. A. True. B. False. The answer is false. 16. A blank is a device such as a splint or brace that helps support and align a limb and improve its function. A. Splint device. B. Brace device. C. Orthotic device. D. Pillow device. The answer is C. 17. The perineum is the A. Vocal and skin area. B. Mucous and genital area. C. Genital and back area. D. Genital and anal area. The answer is D. 18. A blank is a substance added to another substance, changing its effect. A. Additive. B. Subtractive. C. Partial. D. None of the above. The answer is A. 19. Common sites for pressure sores are A. Thigh. B. Shoulder. C. Chest, nose, and hands. D. None of the above. The answer is D. 20. The blank is the area from the pubis to the upper thighs. A. Buttock. B. Groin. C. Abdomen. D. Perineal. The answer is B. 21. A blank is a sturdy chair designed to be placed in a bathtub or shower. A. Jerry chair. B. Wheelchair. C. Shower chair. D. None of the above. The answer is C. 22. Pediculosis is an A. Infestation of mice. B. Infestation of pests. C. Infestation of bugs. D. Infestation of lice. The answer is D. 23. Blank is an excessive shedding of dead skin cells from the scalp. A. Scab. B. Dandruff. C. Scratch. D. Crack. The answer is B. 24. The medical term for bad breath is A. Indentulous. B. Aspiration. C. Halitosis. D. Pediculosis. The answer is C. 25. Indentulous means A. Having no teeth. B. Having no sweat. C. Having no pain. D. Having bad breath. The answer is A. Section 14. 1. Which of the following is the normal temperature range for the oral method? A. 96.6 through 98.6 degrees Fahrenheit. B. 97.9 through 100.6 degrees Fahrenheit. C. 97.6 through 99.6 degrees Fahrenheit. D. 95.6 through 98.9 degrees Fahrenheit. The answer is C. 2. Which of the following is the normal temperature range for the rectal method? A. 98.6 through 100.6 degrees Fahrenheit. B. 96.7 through 98.6 degrees Fahrenheit. C. 95.6 through 98.9 degrees Fahrenheit. D. 98.6 through 99.9 degrees Fahrenheit. The answer is A. 3. Which of the following is another word for mouth? A. Axillary. B. Rectal. C. Tympanic. D. Oral. The answer is D. 4. Which of the following is another word for ear? A. Axillary. B. Rectal. C. Tympanic. D. Oral. The answer is C. 5. Oral thermometers are usually blank in color. A. Yellow. B. Green or blue. C. Black. D. Lavender. The answer is B. C. Rectal thermometers are usually blank in color. A. Yellow. B. Green. C. Blue. D. Red. The answer is D. 7. Which temperature is considered to be the most accurate? A. Rectal. B. Oral. C. Tympanic. D. Axillary. The answer is A. 8. Which temperature is considered to be the least accurate? A. Oral. B. Tympanic. C. Axillary. D. Rectal. The answer is C. 9. Why are mercury-free thermometers safer than the mercury thermometers? A. They are more expensive than mercury thermometers. B. They do not contain dangerous substances like mercury. C. They are easier to read than mercury thermometers. D. They are easier to hold. The answer is B. 10. Where is the most common site for monitoring the pulse located? A. In between the elbow and the shoulder. B. In between the thigh and the leg. C. On the feet. D. On the inside of the wrist. The answer is D. 11. Where is the brachial pulse located? A. In between the elbow and the shoulder. B. On the side of the neck. C. On the feet. D. On the left side of the chest. The answer is A. 12. Which of the following is not a common pulse site? A. Radial. B. Apical. C. Femoral. D. All of the above. The answer is D. 13. A blank is an instrument designed to listen to sounds within the body. A. Sphygmomanometer. B. Stethoscope. C. Pen. D. Thermometer. The answer is B. 14. What is the process of breathing air into the lungs? A. Perspiration. B. Dyspnea. C. Respiration. D. Expiring. The answer is C. 15. Count the heartbeat for blank full minutes to measure apical pulse. A. 1. B. 3. C. 2. D. 4. The answer is A. 16. The normal respiration rate for adults ranges from A. 40 to 60, B. 12 to 16, C. 15 to 30, D. 12 to 20. The answer is D. 17. Infants normally breathe at a rate of blank to blank cycles per minute. A. 24 to 30, B. 15 to 35, C. 30 to 40, D. 12 to 16. The answer is C. True and false. 18. Heat relieves pain and muscular tension. The answer is true. 19. Hot application can stop bleeding. The answer is false. 20. Ice packs is considered to be a dry applicator. The answer is true. 21. Disposable heat compresses are used more than once and then discarded. The answer is false. 22. Sitz baths clean perennial wounds and reduce inflammation and pain. The answer is true. 23. Sterile dressings do not cover open or drain wounds. The answer is false. 24. IV stands for intravenous or into a vein. The answer is true. 25. A nasal cannula is a piece of metal tubing that fits around the face. The answer is false. Section 15. 1. Blank is how the body uses food to maintain health. A. Carbohydrates. B. Nutrition. C. Fats. D. Protein. The answer is B. 2. What is something found in food that provides energy, promotes good health, and helps regulate metabolism? A. Oil. B. Fat. C. Vegetables. D. Nutrients. The answer is D. 3. Blank promotes growth. A. Protein. B. Grains. C. Minerals. D. Fruits. The answer is A. 4. Carbohydrates are basically needed for blank. A. Growth. B. Strength. C. None of the above. The answer is B. 5. Fats help the body store blank. A. Vegetables. B. Fruits. C. Energy. D. Milk. The answer is C. 6. Vitamins blank, 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 and blank are fat-soluble vitamins. A, D, E, and K. B, C, and D. C, K, B, and E. D, none of the above. The answer is A. 7. Which of the following is not an example of a mineral? A. Zinc, iron. B. Calcium. C. Magnesium. D. Vitamin B. The answer is D. 8. 1/2 to 2/3 of our body weight is A. Fat. B. Water. C. Food. D. Blood. The answer is B. 9. Calcium is used for building blank and blank. A. Hair and skin. B. Fingers and toes. C. Bones and teeth. D. Nose and mouth. The answer is C. 10. Blank are the major source of monounsaturated fats, MUFA. A. Oils. B. Milk. C. Beans. D. Meat. The answer is A. True or false? 11. Physical activity and nutrition work together for better health. The answer is true. 12. Many elderly people take a variety of medications which can affect the way food smells and tastes. The answer is true. 13. Thickened liquid includes water and juice. The answer is false. 14. Nasogastric tubes are inserted in through the stomach. The answer is false. 15. Nursing assistants are responsible for inserting and discontinuing tubes. The answer is false. 16. Foods' likes and dislikes are influenced by what you eat as a child. The answer is true. 17. The dietary department also makes diet cards. The answer is true. Match the following. 18. Low sodium diet. The answer is F. No salt added. 19. Dysphagia. The answer is H. Difficulty swallowing. 20. Vegetarians. The answer is E. Do not eat fish or poultry. 21. High potassium diets. The answer is G. Get food high in potassium. Banana, grapefruit. 22. NPO. The answer is A. Nothing by mouth. 23. Low protein diet. The answer is B. Restricted protein. 24. Liquid diet. The answer is C. Clear juices, broth, gelatin, and popsicles. 25. High residue diet. The answer is D. Helps with constipation. Section 16. 1. Urination is also known as A. Number 1. B. Defecation. C. Micturition or voiding. D. None of the above. The answer is C. 2. Urine is made up of A. Fruits and vegetables. B. Water and dye. C. Mucus and water. D. Water and waste products. The answer is D. 3. Adults should produce about blank to blank milliliters of urine per day. A. 2,000 to 4,000. B. 1,200 to 1,500. C. 400 to 600. D. 60 to 100. The answer is B. 4. Urine is normally blank to blank in color. A. Pale yellow to amber. B. Pale pink to red. C. Pale yellow to orange. D. Green to blue. The answer is A. 5. A healthy person needs to take in from blank of fluid each day. A. 40 to 60 ounces. B. 20 to 40 ounces. C. 50 to 70 ounces. D. 64 to 96 ounces. The answer is D. 6. Blank is a bedpan that is flatter than the regular bedpan. A. Woven pan. B. Twisted pan. C. Fracture pan. D. Standard pan. The answer is C. 7. Urinary tract infection UTI causes A. Inflammation of the kidney and nephron. B. Inflammation of the bladder and ureters. C. Inflammation of the perineal area. D. None of the above. The answer is B. 8. Another name for kidney stones is A. Calculi. B. Calculus. C. Catheter. D. Cystitis. The answer is A. 9. Which of the following is not a symptom of calculi? A. Groin pain. B. Chills, fever. C. Sore throat. D. Flank or back pain. The answer is C. 10. Inflammation of the kidneys is A. Cystitis. B. Nephritis. C. Edema. D. None of the above. The answer is B. 11. Blank is a condition in which a blockage of arteries in the kidneys causes high blood pressure. A. Renovascular hypertension. B. Rhinovascular hypertension. C. Renovascular hypotension. D. Renovascular hypertension. The answer is D. True or false? 12. Excessive salt in the diet can also cause damage to the kidney. The answer is true. 13. A catheter is a thick tube inserted in the body. The answer is false. 14. Nursing assistants insert, remove, and irrigate catheters. The answer is false. 15. Straight catheter remains inside the body. The answer is false. 16. Indwelling catheter is removed immediately after urine is drained. The answer is false. 17. Kidney dialysis is an artificial means of removing the body's waste products. The answer is true. 18. A specimen is a sample that is used for analysis in order to try to make a diagnosis. The answer is true. 19. A clean catch specimen is also called midstream because the first and last is not included. The answer is true. 20. The pH scale ranges from 0 to 14. The answer is true. 21. Normal pH of urine ranges from 8.4 to 9.0. The answer is false. 22. Kidney stones are produced when the body burns fat for fuel. The answer is true. 23. Illness and diseases can cause blood to appear in the urine. The answer is true. 24. Always show anger and frustration towards residents who are incontinent. The answer is false. 25. Never report changes in skin color. The answer is false.